At age 55, Raymond Sismaet was a healthy, active, retired Marine, a father of 3. But during the month of March, while much of America stayed home, Raymond stayed here in the COVID-19 ward at the University of Washington Medical Center Northwest, where we were first given rare access last week to see their innovative work.
People of all ages and all physical conditions, this can hit you pretty hard, can't it?
100%, and I was one of those people.
Hospitalized in early March, Raymond was struggling to breathe, so doctors put him on a ventilator for 18 days.
I felt very surreal about whether this was happening to me or not. It didn't feel like I belonged there. It didn't feel like I was in disbelief. It was very tough to consider that there were some days that my wife had to talk to the doctors and there was no progress some days, and how close it was to not making it.
Infectious disease doctor Maggie Green helped care for Raymond, who was one of their first COVID-19 patients and one of their youngest.
And here's this healthy man coming in critically ill. It was frightening for all of us.
Early on, they got permission to use an experimental drug, Remdesivir, one of several potential coronavirus treatments now in clinical trials, though Raymond only got part of the recommended treatment course because his liver enzymes began to spike.
I think he only got 5 or 6 days worth, and he got better, but we know that a lot of people get better anyways. I don't know how the drug helped him or if it did, and that's why we need these trials.
Raymond's wife, Jill, also tested positive for COVID-19, but her symptoms were mild. The hardest part was not being able to see her husband in person, just FaceTime.
I can't even tell you how excited I was just to see him, even though he didn't look so great.
Raymond, I can tell for you, that's the part that gets you more emotional, thinking about what your wife and family went through, right?
I just remember that FaceTime, I was still out of it, and I just remember all of a sudden I heard them over the phone. It was wonderful.
That was a good day.
The other day that stands out is the one when he got off the ventilator. His medical providers celebrated too.
For him to get better really just gave us some hope that everything we were working so hard for was not for nothing.
It was a victory because unfortunately a lot of people didn't make it out. So I think that's why they were celebrating. I couldn't figure out why, but now I know.